Alrighty, good evening, everybody, and thank you all for joining us today. My name is Valeria Valbuena, and I'm a fourth-year general surgery resident at the University of Michigan and the director of the Inside the Operating Room webinar series. On behalf of the founding members of the Latino Surgical Society, I want to give you all a warm welcome and thank you for joining us tonight. The Latino Surgical Society was established to cultivate, nurture, and support the advancements of Latinos, and today's event is in line with that mission. We want to thank our institutional members who have supported the LSS, but also the faculty and the trainees at each one of their institutions. We have had some recent developments in our organization that you can find more on our website. We have recently selected a couple of interns to help us with some aspects of the behind the scenes of the organization. And we want to thank the newly appointed advisory board. Last but not least, we want to thank you all our members for supporting and believing in the Latino Surgical Society. Now, I would like to welcome our session moderators, Dr. Richard Sola and Dr. Joseph Fernandez Moure. Dr. Sola is an assistant professor of surgery at Morehouse School of Medicine and an acute care surgeon at Grady Memorial Hospital. He completed his general surgery training in Charlotte, North Carolina, and his surgical critical care training at Kansas City, Missouri. Before joining the Grady Trauma Program, he was an acute care surgeon at a regional medical center, Bayonet Point in Hudson, Florida. His clinical interests include trauma, critical care, surgical education, and wellness. His research interests include trauma and critical care outcomes. Dr. Fernandez Moure is an assistant professor of surgery at Duke University. He completed his general surgery training at Houston Methodist Hospital in Texas and his trauma critical care fellowship at the University of Pennsylvania. He is a translational surgeon scientist with a focus on the intersection of thoracic trauma, orthopedic tissue engineering, and functionalized biomaterials research. Tonight, we have the pleasure of welcoming Dr. Paula Ferrada for the 5th installment of our series. Dr. Ferrada is a professor of surgery at the Virginia Commonwealth University. She attended medical school in Colombia and La Universidad del Valle and completed her surgical residence at the Beth Israel Deaconess Medical Center. She trained in trauma and critical care at the University of Pittsburgh and was the first acute care surgery fellow of the R. Adams Cowley Shock Trauma Center at the University of Maryland Medical Center prior to joining the faculty at VCU, where she currently serves as the medical director for the surgical and trauma ICU and the program director of their surgical critical care fellowship. Dr. Ferrada is an expert in critical care, trauma, and emergency surgery, as well as image-based resuscitation of the trauma patient using echocardiogram. She has held multiple leadership positions in local and national organizations. She's a very active member of many global surgery and global surgical education organizations through her membership in the Pan American Trauma Society, through which she has facilitated ultrasound education in Latin American countries. In addition to her academic and clinical work, Dr. Ferrada is an accomplished researcher with more than 100 peer-reviewed publications. Her work has led to significant advances in trauma resuscitation and surgeon-performed ultrasound. Join me in welcoming Dr. Ferrada and our moderators today. It's a pleasure to have you, Dr. Ferrada.
Thank you so much, Dr. Valbuena, for that humbling introduction.
Hi, good evening. Thank you so much, Dr. Ferrada, and everyone, welcome to our webcast this evening. Dr. Ferrada, just a little bit of a background about yourself and your journey from Colombia to Virginia, United States. Tell us a little bit about that.
Right. So my dad is a trauma surgeon, and my mom is an OB-GYN nurse. My mom is retired. My dad still works. And when I was little, when we didn't have childcare, I used to just go to work with my dad, and I started just hiding under the operating room desk and escalated for me to start scrubbing in when I was really little. And it was okay. Like, it's not that it wasn't the rules. I don't think there was a rule against that. So I was enamored with surgery from really early on. And my dad used to have friends that come to Colombia because Colombia was full of trauma, right? We had tons of penetrating trauma. It was at the time where there was the cartels fights and all this craziness in the country. So it was terrible socially, but it was great and a great opportunity for training. So we have people from Israel, from the United States, just visiting the hospital, sometimes staying in our house. And I got to meet very interesting people, among those Dr. David Feliciano, many that came to Cali to do trauma. And I just, was infatuated with like coming to the United States and learning more about it. And I remember the conversation happened with Dr. Feliciano, who basically, I was telling him, look, I really want to know how do you do things in the United States. And he invited me, but I think he thought that I was gonna, it was just an invitation, but it was just a word that actually I was not gonna follow through, but I did. And then I went there for 4 months. And my jaw dropped when I saw that they had a helicopter, and I trained in a state hospital. So sometimes the patients have to pay for the families have to pay for the sutures. So you can suture the face with something that wasn't silk, right? I had the needles that I had to put the silk through. That was what we did in our hospital. So to go to a place where they had a helicopter, they had a CT scan, I was like, wait, what? This is amazing. And then at the time, Dr. Rosicki, that's when I started getting interested in ultrasound. Dr. Rosicki was there at the time. Dr. Rosicki, for those that you don't know, is the one that developed the FACS ultrasound. Yeah. And I was just like, this is amazing. I have to come back. And I always did it thinking that I was going to go back to Colombia and give back in some way, shape, or form. And I came back to medical school and I bought all the books in English, and everybody thought I was crazy because the Harrison is complicated as it is in your native language. Right. But I was reading in English because I wanted to then take the steps and train my brain. And then I came to Miami, and it was wonderful. And I'm really grateful for the experience that I had in Miami. I did not get a categorical spot, but that gave me the opportunity to go to Boston, and I learned tons from Boston, like not only surgery and medicine, but leadership, self care, self-leadership. Oh my God, I think I spoke Spanglish until before I went to Boston. And then I got the opportunity to go to Pittsburgh, meet more people, shock trauma. And then when I was deciding where to go, at the time, Roy Vaturi was the boss. And I have met Dr. Vaturi when I was 17. So it felt like I was going home, not that I was going to Virginia. It felt like I was like had a piece of a home with me, and a good mentor, and a good sponsor, and somebody that will in some way, shape, or form guide me in the way that my father would. And that's how I ended up in Richmond. And it has been a good 10 years where my career had continued to progress. And so that's why I'm here.
That's awesome. That's a great journey. You've been, all over the East Coast in this country. Mm-hmm. Who do you think are your probably most important mentors and sponsors through this process? From, you talked about Dr. Feliciano and the folks in Boston, and then obviously Virginia. Is there anyone else that comes into mind that we didn't speak of?
I think that for anybody that is listening, I think that you don't need one mentor, you need tons of mentors. And you're gonna have people that are gonna give you advice about life, about research, about clinical stuff, about leadership. And nobody's perfect. So pick the person that it will be best for the advice that you need. Dr. Flashlight has been great for me in terms of leadership development, and a lot of mentors that are not women, there was no male, and not necessarily Latino. Dr. Feliciano took me under his wing. Dr. Rosicki, Dr. Tom Scalia has been there in las buenas, in las duras, en las maduras, in the good one, and in the bad times. He has always been there for me. I can name like a good dozen of people. It takes a village. I don't know that I would be here where I'm at if I wouldn't have their help and their support, advice, all of it. Dr. Vaturi, I don't know. And then there's people also that I met during training. Mark De Moya, for example, he was my fellow when I was a PGY2. And because I did internship and then PGY2 in Miami, and then I had to repeat the PGY2. Some of you that are foreign graduates know that you have to promise your unborn child to get into surgery. So, and then Mark he knows me for a couple of decades. Luckily he doesn't think that much has changed, right? Maybe the accent is better. No, tons of people. And I think so it's a circular Ferrada long story, but I think the moral of the story is, if you want mentoring, if you feel that you don't have enough where you are at, just send a Twitter message or like, or corner somebody in a meeting, or send an email. A part of, if you're in academic medicine, part of what you do is mentoring and helping and sponsoring. And if that person says no, then it was not meant to be. There's 10,000 more that will be willing and honored to help you. So raise your hand.
Yeah, I mean, I 100% agree. And, the one question too is, you talked about a lot of the acute care surgeons as mentors. And the one thing I valued in my training is actually mentors outside of my specialty in terms of acute care surgery. Any other mentors outside of the acute care surgery world that you've talked about that helped you during your surgery career so far?
Right. So Adnan Al-Sedi, as a hepatobiliary surgeon, great friend and mentor, is I have when I was at the deacon, this person doesn't even have anything to do with medicine. When I was so I'm Catholic. and I believe, and I know, and I believe that things happen for a reason. I have like this tremendous faith that even if I don't go to mass, that doesn't matter how bad the hardship of the moment is, that there's a purpose and then a light at the end of the tunnel. So the person that used to give me the most advice and the most conscious advice is Father Bruce. It was the priest of in the deaconess, and he still follows me in social media, which is endearing. But yeah, I mean, I think opportunities to find somebody that is going to help you, and sometimes you just need a couple of words that will bring light to the situation to help you get to where you went.
That's great. That's fantastic. And tell us a little bit about your ties back in Colombia still. How's your in practice, and obviously in our community back in Colombia, and also with family?
Right. So my father is still a practicing surgeon. He does now mostly burns. He's also 73, but that's what he wants to do. He doesn't want to retire. He and some of his friends founded the Pan American Trauma Society, which is mostly, again, trauma related. Through that, I started working on that pretty early on. That's how I took the ultrasound course that I created for Virginia Commonwealth University, and I have been able to teach it like in 10 countries through that society. And Dr. Ravi Vachuri was the executive director. Now the executive director is Dr. Scalia. So that had gave me the opportunity to not only be working with many of my mentors, but also to be able to give back to Latin America, because it's not only Colombia. We have been doing this with Argentina, with Ecuador, with Bolivia. There's tons of things that we do, that I do in terms of international work, and the needs are different in every place, right? There's right. If you want to like serve an underserved community, you can go to the United States. Here, a little bit outside of Richmond, you have beautiful hospitals with no people working on them, right? So they have the infrastructure, but they don't have the personnel. And then in some places in Latin America, there's a tons of people, but no sutures. So I think the problems are different in every place where you go. And I think having the flexibility and the vision to be part of the solution is key.
And then how do you see our role as the trauma surgeons in terms of being champions for the population we serve, as you mentioned, in both United States and Colombia and around the world?
So I think it's very important that we understand that surgeons are not only, I mean, if you want to just take care of patients, that's fine. That's awesome. That's great. It's what gives me purpose. And for me, trauma and being able to open somebody's chest and bring them back to life is like chocolate cake. Right. I cannot live without it. It just feels amazing. It feels like nobody thanks you, but you're happy that you did something good. You look in the mirror and you're like, yeah, I can do this. But there's so much more to do. Look, we see we see the injuries one after another. We see the patterns of injuries. We have an understanding of the social problems of a region better than anybody else. So I think when people talk about leadership, I think it's a responsibility of us doing something more than just, closing an abdominal wound and right. There's opportunities for that in the United States through college and advocacy and leadership. We just got done with the advocacy and leadership meeting and talking to the young surgeons of how important it is to get involved, and even if it is just meet with your state legislators to explain to them why is it that it's important, that what we do is important. And I think you can take that from the smaller white coat meeting that we have in every state to meeting with the people that are taking the decisions for resource allocations. And I know surgeons in Latin America that are like in the senator's office constantly to help serve their patients at a larger demand. So I do think that there's, like, we used to say that academic surgeons are like the triple threat of writing, doing research, and being good clinically and service. But also I think we have to add tons of legs to that, right? You can be a leader, you can be there's so many other things that you can be an advocate for your patients. There's so many other things that you can do. And I don't think a title or should define what is it that you're going to do with your career and how you're going to find fulfillment and purpose in life.
I agree 100%. I think we've the trauma surgeons, and especially in Richmond and here in Atlanta, we could give so much to our community, 100%. So I know you're with Pan American Society and then the East, and I know you were part of the initial East for All committee. Tell us a little bit how you got involved in that, and then how that role in East for All and surgical societies like East can help initiate partnerships with underrepresented minorities societies like SBAS and then Latino Surgical Society.
So how we had a group of people that were just friends that Rob Winfield, Dr. Williams, Dr. Sackerstone, Rishi Ratan. We used to just sit after meetings and just have coffees or sometimes drinks and talk about how we needed to do something better to start talking about underrepresented minorities, not only in our profession and how we're treated differently and how we have less opportunities and how sometimes people are placed in more difficult situations and singled out and not allowed to progress, but also how that affects our patient population, right? And the role of us as a society perpetrating violence for certain populations. We saw it in COVID, how some populations got more affected than others, and how we as a community can do things that can help those populations better. And it ended up, it was at the beginning just conversations. We used to just talk about it and kind of strategize in our own ways. Oh, so let's send this to that. Let's send this to that. It was like our own little informal committee. And then Dr. Bernard at the time, Andrew Bernard was the president of East, came to Dr. Sackerstone, and she and came up with the idea of making it a committee. I mean, not a committee yet, but a work group. And then that allows a lot of people. It's almost like you get permission to speak. Because a lot of these is it's a little bit like gossip, right? People kind of know that something is happening, but nobody really knows why or how. So when we got the opportunity, I remember it was a couple of years ago, it was a plenary session. We got the opportunity to sit. When you have the opportunity to sit with pretty powerful people like Dr. Patricia Byers, not Latino, right? Not underrepresented minority, but a pretty powerful woman that a little bit intimidating to be around, of how strong she is. And she's breaking down, telling you stories, how she felt during training. It makes you feel that you're not alone. It makes you feel, and I think it brings legitimacy about the issues to everybody else. There needs permission to speak because people, I think in general, when you have somebody that is single out, or as a society, maybe those people get highlighted that this is happening to you because you're weak, or shaming you. This is happening to you because maybe you're not good enough, right? But when you see that it happens to people that are awesome clinically and administratively and in leadership and people that you respect, you're like, okay, if it happens to that person, it can happen to anybody. And it gives you the permission to speak about it. And it gives you the permission to come together and do something important as a healthcare community about it.
That's great. And that's a great part of the committee and part of East that as a newly East member, I'm hoping to be involved in the upcoming future. So, you've, Columbia, Virginia, and now a professor of surgery and so well accomplished. How about the obstacles getting from there to where you are now? What do you think is your greatest obstacle in getting your career to where it is now?
We can spend another hour, and
right.
There's a ton of stuff that I can talk to you about.
You got like 10 minutes.
Some of it online and offline. I can tell you one thing. I know this is going to sound cliche, but just bear with me for a minute.
Okay.
It doesn't matter what the obstacle is. There's going to be tons of obstacles. And I have never met anybody successful, especially an underrepresented minority successful, that has not had obstacles. It's going to be hard. Nobody says life is not fair. And that just, you have to just erase it from your mind that the Hello Kitty world, it does not exist. It's going to be unfair. Things are going to happen. There's going to be personal and professional difficulties. The question is like, what are you going to do with it? Right. So honestly, I think the harder obstacle that you can find as a person, or I'm not saying you as the role, you, Paula Ferrada, is the one staring me at the mirror. Because if I know I can do it, you just have to take deep breaths, calm yourself down, and think it out. If you think you can do it, you can do it. It's only a matter of time. And that's how I'm going to leave it. But I can tell you that I haven't had smaller, I have talked to some of the mentors, some people that I have talked about obstacles are like, I'm like, how did you make it? And people say, oh, I was always in the right place at the right time. And I'm like, that's wonderful. That has never happened to me. I have always have to position myself at the right place at the right time. And then to talk people around it to get to what I wanted. But the truth is just don't I think things that get you through it, gratefulness and being present at the moment and grateful for what you have. So you have your health, you have your training, you have your brain, you have the people that love you around you. Nobody can take that away. So what are you going to do? You can sit down and be upset that things are unfair, or you can do something about it.
That's exactly right. And then, I went to med school in Puerto Rico, and then I was a prelim like yourself in North Carolina. So, you just have to keep working hard, persevering, resilience, and then we get to where we are. So I think that's great advice to the folks on, especially the students, the foreign grads, everyone here, on how to just keep on working hard, and you're going to make it. Just keep on working hard. So we're going to backtrack, let's say 20, 30 years from, earlier. What advice would you give yourself about 20 years ago, looking back, and what would it be?
So I hope it doesn't come out as overconfident. I think that, yeah, of course you can exercise more, sleep more, eat more chocolate, whatever. I think if I can tell myself, I don't regret anything in my life, because whatever happened got me to where I am right now. So all these things of if I could have, I don't have that, because if you live in the past is in the past, the future hasn't happened, what you have is today, right?
Right. Exactly. That's
just how I am. But I guess I will tell myself, stop crying, everything's gonna be fine. There's no crying.
Suck it up, it's gonna be good. We're gonna make it. We're gonna make it.
I'll be like, you know what? It's gonna be fine. It's gonna be fine. It's gonna be fine at the end. It's not fine, it's at the end.
Even though it doesn't feel fine. Right.
No, it
That's
doesn't.
good. I know.
But that's part of like that's part of growing, and that's part of in any. It's not only surgery, right? It's
Right.
in any field. If you really want to be successful, you have to just there's some stuff that you have to put. The people only see the tip of the iceberg. They don't know what's underneath, and that's fine. Cover up with makeup.
So, I'm one of the co-chairs of wellness here at Grady. So we're going to go outside of the operating room, outside of the hospital. What do you like to do outside of the hospital in Richmond? Especially now, it's May, it's beautiful weather. It's almost Memorial Day weekend. What would you be doing this weekend?
Yes. So you're absolutely right. In the last few years of my life, I have worked in my wellness, also because I am also 44. So I am the second half of my life, and I want it to be long. We have now this house in the river, and we just like chill. My son likes to fish. I have a son and a stepdaughter and a dog and a cat and a fiance and an ex-husband, and it's like my life is complicated, right? But we have a great time. We have a great time in the river. Yesterday or the day before, on Sunday, I decided that I wanted to swim from the dock to a little beach, and it was like 1,000 yards, which I thought it was a lot shorter than it was. But like just things like that, being around nature, cooking, being around nature, trying to be healthy.
Yeah, I missed the beach in Atlanta. Like, I've got to drive now 3 hours, any sort of water. We have some rivers, but I'm
Right.
Puerto Rican, so I
Yes.
grew up in
Oh my
Florida.
God.
So the beach, I miss it. So
Yeah.
I try to get home when I can. So that's fantastic. And then, so for rising Latinx and Hispanic students, especially during this time, what would you hope for them aspiring to be surgeons moving forward? What advice would you give them?
I think don't there's no obstacles that is big enough if you really really want it. It sounds cliche, but it is the truth. Like, it sometimes feels that you're not gonna make it, but you are gonna make it. You just need to wait it out, persevere, find a way out. I think that we're all trying to make the system better and more fair, but until that happens, don't give up. Right.
Right.
I think it's critical for people that, like, when we talk about burnout, I think the one thing that is critical to prevent burnout is knowing that you have a purpose, and the purpose is different for each one of us, right? Like, success looks different for each one of us. What is your success look like? Just find what you like, find what you want to do, and do it. Like, not trying to please anybody else but you. I think that is hard for people that are people pleasers. We're all people pleasers, so otherwise we wouldn't be in medicine. Yeah.
There you go. This is recorded too, so students, everyone, just play this over. There's your advice for the rest of your career. That's fantastic. So I'm going to go back to the operating room. So describe a little bit about your teaching style in the OR, and then how with the students and the trainees.
So I believe in graduate independence, meaning if you get to do a lot in the OR, it's because you show that you're competent. If you don't get to do much more in the OR, then maybe we just have to work in technique and how to do it, right? But I also think that if trainees don't get, like, if you're taking over everything in the operating room, they're not going to get the opportunity to learn to be real doctors and real surgeons. So I think graduate, and you see it in the ACGME milestones, right?
Right.
When you graduate as a chief resident, part of the GME milestone is he or she can work independently. How are you going to know if you're never have been supervised of working independently? Tricky.
Right.
So I think
Exactly.
that is my style. I try. So it took a while for me to understand that some people find me intimidating because I'm like short and I'm super nice. But
A nice surgeon. Let's not spread the
no,
rumors.
but
Please don't spread the rumors.
I think when I'm in the trauma bay, because I'm like so goal oriented, and sometimes I'm like, do this, do that. Like, so people like, so I try to like tone it down, unless there's audible bleeding, introduce myself, explain what we're doing, bring them in, right? And maybe make a joke or two, because I think when people understand that that we're human, like we're not, we're not made of rocks, we're humans. So
Any music in the OR? to calm them down a little bit?
Not
Or no,
not
are you not a music
Yeah,
person?
so not during trauma. During trauma, because I need people to actually listen to my
Focus.
voice.
Yeah.
Yes. But when we're doing anything that is elective or emergency general surgery, we do I put classical music,
Oh, really?
which is
Yes.
a little bit spooky for some people, but I think it calms your brain down.
Or if it's after lunch. When I was training, I had one of my attendings, and I might have fallen asleep once or twice.
No.
So I always like, okay, which is going to be the up or down. So, but that's great. Now it's interesting for me because I used to play music all the time and train, or preferred it, and now as junior faculty, actually prefer it not on, as you said, so I could kind of listen, and I could listen to myself teaching, listen to them trying to communicate with me. Because as you said, as junior faculty, I think for me it's been hard to that graduated autonomy, and then as junior faculty, how much as a junior faculty do I give them to do if maybe I might not be comfortable if it's more of a complex trauma case. What am I taking over more as the faculty? How do I communicate that? So that's great. And
No,
then
I
how?
that perfect. So I think the graduate autonomy in like in something like a take back or EGS much easier than when you have a trauma case. A trauma case,
Right.
most of the time it's me doing it,
Right.
just because there's a life at stake, right?
Yeah.
Yeah.
And then do you find, is your teaching style in the operating room any different? For example, like the ultrasound curriculum in the ICU. So how do you, how's the teaching in the ICU and in the ultrasound? How's that a little bit different?
Yeah, not only the teaching, but I think that for surgeons, it has to be crystal clear that if you approach every situation in life like you approach a trauma bed, you're not going to be successful. Because when you're teaching nurses and medical students, and when you're in the ICU and the pace is different, or when you're in the boardroom or you're somewhere else, then the decisions need to be democratic, and you need to listen to everybody. And in order to take a good decision, it has to be like everybody has to be part of it, right?
Right.
You cannot take a democratic decision in the trauma vein who's going to open the chest and clamp the aorta. That just happens. It needs to happen now, right? But so you have to balance both. Yeah, you have to be assertive and fast when you have to be assertive and fast, but don't be always a trauma surgeon, because then nobody's going to want to be around you.
100%. 100%. So I think I've got about 5 more minutes. So I came up with some questions in terms of those rapid fire. Okay. Because you lived in Miami and then you're from Colombia. So is it Cuban coffee or is it Colombian coffee? Because I'm biased. I'm Puerto Rican. I'm saying Puerto Rican coffee. That's what I drink all at home.
Colombian.
Okay. There it is, folks. And you've Columbia beaches, Miami Beach, or Virginia Beach? Which beach is the best?
The beach that I can get to.
That's the best answer. I agree 100%. Mine is 3 hours away, and we're going in about 2 weeks. And then, and just for my end, and then wrapping up, is there, and how about from myself as a junior faculty to to a professional in terms of academia and faculty development? What advice would you give junior faculty surgeons like myself and Dr. Fernandez moving forward in our academia?
Set up, I think what helps me, and sometimes I write it out and I spook myself, because sometimes I write things down and I forget about it, and like 3 years later I come back and I read what I wrote and everything came true. Like I have witchery powers. No, I think no, seriously, I think that if you sit down when nobody's bothering you, with your beverage of choice, and come up with how do you see yourself and what do you want to be in 1 year, 2 years, 3 years, 5 years, 10 years, whatever you said that is going to be your parameter. And your time and your ideas can change, but if you have a path, it'll be easier to get the resources that you need to get to that path. Find mentors, make sure that you learn how to manage people down, meaning bring the people, give the people the opportunities that you have been granted, bring them along, pay it forward. Something that I have learned to do, but have not been great at, is managing up. Like, I think you need to be able to get people above you to support you and help you. And without that support and help, then you cannot advance.
Right.
And find mentors and sponsors. I mean, don't be shy. The worst that people can say is no. And then guess what? There's 10 more people that are willing to do it.
Right. I agree 100%. That's one thing too I'm learning is how to say no. That's the hardest part sometimes. But I think I'm going to open it up a couple minutes early. I think this was an excellent talk so far. We've got more questions. We got questions from the gallery. So thank you so much so far, Dr. Ferrada, and happy to. We'll bring the questions on, and Dr. Fernandez Moure will come in as well, and more questions.
Awesome. Thank you, Dr. Sola. Muchísimas gracias, Doctora Ferrada, for your honesty and your participation in this. I got a couple from the audience that I'd like to share. The first one being, could you name any organizations or programs that focus on incorporating advocacy for underserved communities and surgical specialties?
Underserved communities is more like what we can do to make those organizations broader. I think the American College of Surgeons is a great organization for advocacy. There's an entire weekend that we dedicate to leadership and advocacy training and involvement. Then that's nationally, but you can also join your chapter. And I think the chapters are so deprived of young people that if you join, they'll give you work to do, and you'll be able to advance in your career and also advance the ideas that you want in terms of advocacy. So I will definitely recommend join the chapter, go to their white coat ceremony, the white coat date, where they go to the legislators, get involved, and again, don't be shy.
Awesome. Thank you. What would you say to another IMG who wants to pursue the same journey that you did?
I think that we all have different journeys. I think that that the same that I didn't follow what other people did, I do your own journey and go for the things that you want to do. But if you need help, we're here to help you. There's like here already, I see like 4 or 5 people that are willing to help. The labor that you're doing with the Latino Surgical Society is wonderful. I'm sure that there's ways to ask for advice there too. And just like basically, if this is really what you want to do, don't give up, keep trying.
And I've heard that so many times throughout everything. I'm a basic scientist, translational scientist, and at every step of the way, there seems to be a challenge, as you said. And if that's what you want to do, you just keep marching forward, overcoming those challenges. Okay, so now to the sort of rapid fire that Dr. Sola began. And this is sort of a mix of casual questions and sort of, I threw a couple trauma specific ones in there just because I want to pick your brain. And they're sort of in the style of Inside the Actor Studio. For those of us that were old enough to ever have seen that, it is one-word answers to questions that are ranging, like I said, from casual stuff to trauma. So first one, what profession other than your own would you like to attempt?
Dancer.
What is your favorite word?
Awesome.
What is your least favorite word?
It's a bad word. I cannot say it.
What is your one pet peeve in the operating room?
You said one word.
Well, okay. Well, one
Right.
answer. Okay.
Okay.
A quick answer.
Yeah, it was what I said that my dad used to say. There's nothing that you and I cannot fix together.
Mm-hmm. What activity energizes you?
Exercise.
Okay. Routine or selective TXA for hemorrhagic shock?
Routine. I mean, selective.
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 Reboa or ED thoracotomy?
It depends.
Penetrating injury?
It depends. I have done it. I have done it for penetrating. I have done it for penetrating the chest. It worked out, so you cannot argue with success. But some people will argue with me anyway. So I think I think that what you can never compare them. It's never going to be provable by literature. We have tools to save a patient. Use them and save a patient.
Yeah. Yep. Whole blood or component?
What do you have available?
Okay. What sound or noise do you hate?
The nails in the
Chalkboard?
Yes.
Yeah. What is your favorite season?
Summer, definitely.
And what profession would you not like to do?
I don't know.
Okay. Are there anything else from the audience? I'm not seeing anything. Well, I'm going to turn this back over to Valeria. I'd like to say thank you so very much from myself and the rest of the founders for joining us on this 5th installment. It's amazing to hear from pioneers in each one of our own specialties, and this being our trauma edition. It's really awesome to have you here.
Thank you.
You're welcome.
Alrighty, thank you so much, Dr. Ferrada, for joining us for our 5th installment of Inside the Operating Room. I want to thank all of our participants who tune in this evening. And if you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on various social media channels at Latino Surgery. Buenas noches a todos.
Buenas noches.